Hello everybody, my name is Afshan and I will be presenting my topic for scientific working that I am going to present in the winter semester. The topic of my presentation is design of a novel MRI compatible manipulator for image guided prostate interventions, in which we will be discussing design of a manipulator that is actually compatible with magnetic resonance imaging, and we will investigate about the presence of cancers in prostate tissue. So coming further, the first thing we will be doing, we will have an introduction about the prostate cancer and introduction about the manipulator, and that what were the previous techniques used to detect the prostate cancers, and then we will come about the previous work that whether or not there were some devices invented before, international devices that are compatible with the MRI or not. Then we will come toward the structuring of manipulator, basically that what are the basic components. Then we will going toward the experimental setup more, that what are the requirements and what are their respective functionalities, and we have quite a few requirements which includes operation, mechanical components, MR coils, needle selection, why we are selecting needle and what kind of needle we will select. I will definitely describing this thing. The positioning sensing, 3D position sensing for covering the 360 degrees. So MRI image guided software, that will be a graphical user interface for physician perspective. Then we will evaluate the performance, that actually whether we received the actual results or no, and then we conclude up with the pains and gains of the project and whether there is a future prospect of research in this domain or no. Coming toward the abstract, this is basically about a remotely actuated manipulator. The remotely actuated means that it is actuated from the outside, from the bore of MRI, because it will be attached with an MRI, and we will initiate something from outside. When this manipulator is in purpose, we will initiate something from outside, so it can actually actuate the manipulator to perform its functionality. And what is functionality of manipulator? In the coming slide we are going to discuss. This manipulator, what actually it will do, first thing it will access the prostate tissue under the guidance of magnetic resonance imaging, that when we will insert manipulator inside of the body, the needle inside of the body, and then the image MRI will continuously be monitoring where the needle is going and the path of needle and how it will be going. I will be explaining it later. The actual purpose is to achieve the millimeter accuracy for needle under physician control. At end of our presentation, we will actually evaluate that whether we receive this millimeter accuracy or not. This is our main purpose, and whether it is under control of physician or not. And the procedure basically are needle biopsies. We will be performing needle biopsy, in which a needle will be inserted inside the prostate tissue, and the marker placement, that when the needle is going, there will be marker placement, that what areas we have observed, and the therapy deliver, what is the actual purpose, is the delivery of the therapy, what is happening. And all these three steps leads toward our final goals, that the use of this manipulator in vivo canine experiments and clinical trials, that whether this manipulator is feasible for minimum invasive surgery experiments and the clinical trials, that whether it is useful or no. At end of our presentation, we should and we must conclude this, that whether these 4 points are justified or not. About the introduction, the background and motivation. The introduction is about two parts. One is the background and motivation, and the second part is the previous work. So About background and motivation, currently the prostate cancer is one of the most common disease that is actually increasing, and the statistics are very horrible that around 28,000 people died, are supposed to die because of the prostate cancer in America, and more than 3 lakh people are suffering from the prostate cancer. And then so when the situation is such alarming that one has to develop strategies that can actually detect the cancer and deliver the therapy or at the right time. So previously there were two screening methods, the common screening methods. There were two screening methods that were used to detect the presence of a prostate cancer or not. The first one is PSA, that is prostate specific antigen, the presence of prostate specific antigen, and the second one is digital rectal exam. Okay, and what is in PSA, prostate specific antigen test, it is actually detected that whether that the prostate specific antigen is present in the patient or no. If it is present, then it leads to a digital rectal exam, because PSA is not conclusive, it cannot conclude. And the digital rectal exam is basically in which the physician observes the physical what you say shape of the prostate, that whether it is enlarged or no. Then if it is enlarged or there is abnormal behavior, and if PSA and digital rectal exam both shows an abnormal behavior, then definitely we are going to have prostate cancer. And then when it is detected that prostate cancer is detected, then the needle biopsy is normally recommended to determine the type of tumor, that whether it is a benign tumor or whether it is a malignant tumor. And then obviously we are interested to know how much area is affected by this tumor, and to know that the previous or current standard that is used is that transrectal ultrasound guided biopsy, in which we place this ultrasound against the adjacent to the rectum of the patient, and then we perform the biopsy procedures. But then we have some limitation when it comes to exact the localization, sensitivity and resolution of the image. Then the TRUS, transrectal ultrasound guided biopsy, restricts us at that point. So we need something actually to observe which has more detailing, which has more sensitivity, more accuracy, high contrast and high resolution. And for that, MRI affords high resolution and high contrast specifically for soft tissues of the body. And X-ray can be used, but MRI is results with soft tissues, and identifying the tiny lesions is for sure give MRI an edge. So we will be using MRI in our procedure. The previous work, there were a couple of things, the pre-manipulator that were designed previously. One of them was MRI report for brain surgery, and then there was a 6 degree of freedom robotic system for breast biopsy that was used for the closed MR scanner. And keep in mind that in our paper it is also a closed MR scanner. Report, a surgical assist report for use inside an open MRI scanner, device for prostate biopsy, also with utilizing the passive fiducial tracking. We will be discussing what is tracking and what is the passive and active tracking. That is actually part of our paper as well. Then MR compatible surgical manipulator for heart interventions, and I have provided the references at end of my presentation, so anybody if is interested to read about these, so they can definitely visit the references, and you can have a brief information about all these. Going further, the manipulator design, it has few components. One is the needle guide that is responsible for exiting and entrance of the needle, rectal sheath that is actually placed adjacent to the rectum of the patient, and then the needle. I will be showing the picture that how is the rectal sheath and how it is firing the needle, how the needle is exiting and entering the needle guide. The positioning stage, the stage before biopsy, when there is no actuation, and after this we will be having the actual procedure, insertion stage, when the needle exits the needle guide and enter into the patient's, the shaft and mounting for actuation, basically for rotation and translation, that one shaft rotates and it rotates the whole internal gears, which actually then internal gears rotates the whole assembly, and then it triggers the needle guides and the needle is fired from the needle guide. So okay, so this is basically a design. So the first thing we have is these are the flexible shafts that can be adjusted, and these are the mounts responsible for the adjustment. And then we have this insertion stage, that in which the needle goes inside the needle guide. This is the needle guide and needle sheath, which will be placed exactly adjacent to the rectum of the patient, and then there is a tiny needle tip, and this is actually the positioning stage. From outside I will be giving you an inner deep view of positioning stage in coming slides, that how positioning stage actually works. So this is actually a design of our manipulator, a physical model of our manipulator. Okay, coming toward the operation. So there are few things that are required for our functionality. The first thing is that needle should leave the needle guide at an angle of 45 degree with its axis for optimum coverage, because if it will leave with some minimal angle, the problem will be that it will not be able to cover the whole area. Then rotation and translation of the needle guide, that how needle guide will actually receive a command to actuate, that when it has to fire the needle inside the body, exit the needle basically. And then degree of freedom is the factor that is actually required, that how much degree of freedom is required with angles perspective for a manipulator to operate. Actuation requirements, there are two kind of actuation normally happening in the industry. One of them is the straight, and one of them is the curved trajectory. And for example, normal biopsies that are happening normally, they require a fast actuation, and the fast actuation is easy when you have a straight trajectory. But when you have a curved trajectory, you can clearly understand the straight trajectory will be straight, a curved trajectory will be with some angle, maybe this, like this angle, maybe like this angle. So it will be having some angle. In our case, the angle is like 45 degrees, as I have explained above, and according to that, so straight and curved. The fast actuation is possible in the straight, but then limitation is you can't cover the whole area, because in straight trajectory you cannot have all the angles, but in curved trajectories actually you have the freedom to select the angle of your choice. So in our case we are preferring the curved trajectory. And then coming toward the needle channels, that what kind of channel of needle should be, whether it should be a cylindrical channel or whether it should be an elliptical channel. That the cross section actually, that is actually for the purpose, the bigger the cross section, the more good axial view we can get. But if the curvature is less, then the image will not be that much, you can say, the accurate, and it will not be covering the whole point of the site in which actually we are interested. So in our case, they are cylindrical and elliptical channels. Ellipticals are little expensive, and cylindricals are quite economic. So here in our case, we are preferring the cylindrical channel. Okay, coming toward the mechanical components, that how mechanical components will actually actuate. So the needle will leave the guide at angle of 45 degree for optimum coverage. Keeping in mind we are using the cylindrical channel, we are using the curved approach, in which we will have angle of freedom, degree of freedom, that is 45 degrees. The drive shaft, which is connected to the needle guide, as I explained in the photo, the drive shaft, I will be explaining the positional stage later, so I will be giving a proper briefing about that. The needle shaft rotates, which is connected to the needle guide. Okay, and the needle guide has a hole in which the needle is entering and exiting into the body, as we have seen in the assembly of manipulator. And then there are few mechanical components, those are threaded net, actuation shaft, internal gears. The threaded nets, actually there are 3 threaded nets which actually actuates. First they start rotation, they rotate the actuation shaft lead to the rotation of internal gears. Internal gears then rotates the whole assembly, and then the actuation, and this all actuation is provided, the actuation of threaded nuts is provided by bore of an MR scanner. Okay, and so now rotation of small gear leading to the whole assembly rotation. So now the whole assembly is rotation, and the needle guide knows when it has to exit the needle from the needle guide. Okay, medical grade heat shrink adjustment of depth by scale. We have a scale in which we are measuring that when we are inserting the needle into the body, that what kind of depth it is having. We can't insert it to then the required area, so we have to adjust the depth, and so we can measure it by a scale, that to what degree we are inserting the needle. Okay, so this is basically about mechanical component and the positioning stage, in which we have basically the rotation and the actuation shaft. These two shaft basically rotates. Okay, when they rotates, they help the internal gear to rotate actually, and this rotating nut as well. These two rotates the rotating nut, which rotates the internal gear. Internal gear itself remains stationary, but it helps the rotating nut to rotate, which leads to the rotation of the driving shaft. And when the driving shaft is rotating, then it is from this end, it is connected to the needle guide, then it knows that when it has to fire the needle. So I hope I have explained it quite right. Then coming toward the coils perspective, that what kind of coils we are using. We are having 2 kind of coils. The tracking coil for position encoding, the position encoding of the needle, the encoding of the path of the needle. The second type of coil is the imaging coil around the sheath for imaging, that is basically taking out the image, that is imaging coil. And one is tracking coil for position encoding. The second one is imaging coil used for imaging. It is rotate around the sheath. Design for MR coils, elliptical cross sections. We have better SNR ratio, cylindrical cross sections for patient comfort, and as I explained before, that elliptical channel and cylindrical channel. So elliptical has higher SNR ratios, but then it is it causes discomfort for the patient, so we don't prefer the elliptical one. So we will prefer the cylindrical one, because of its cost effectiveness and keeping the comfort of patient in mind. uh, so these are actually the results of the imaging coils which are actually placed. This one, the first coil is in this assembly is placed with metals. Okay, I will be explaining why the metal is causing the problem, because there is high magnetic field already inside, and then if we are using some metallic ball joints and metallic nets, then this kind of effects are supposed to happen. So in this the millimeter error are replaced for the errors over the displacement of tracking coils are observed, and you can see that only the coil 1 initially it is observing it is actually facing the metallic interference or something, so it is giving the graph is going quite higher. Then we are coming toward the second, the errors in millimeter displacement from the tracking coil in millimeter, in which also the first coil is facing the vicinity of metals, so it is showing some abnormal behavior at start, but then it is coming toward the optimum level. And the bronze flex shaft, they are actually, this is the place where everything is not in the vicinity of metal, so all of them, their performance is quite up to the mark, and the error is minimum is maximum, leading to 1 millimeter. So we are using the bronze flex shaft. We also used the aluminium one as well, and we also used the brass one as well, and we prefer the bronze flex shafts. Okay, then type of needle selected. The needle need to exit with the appropriate angle for accurate trajectory. Higher exit angle is a requirement for more accurate and axial view, 360 view of the prostate tissues, actually the full coverage of prostate tissues. But then if we want to increase the exit angle, increasing the exit angle more than a level is basically what it does, it leads toward the deformation. So deformation of the plastic, so we we have to look for the material, that needle we can use which allows the maximum exit angle as well. So so when the exit angle is higher and then we are using a plastic needle which actually deforms, then the target is missed. The first thing, the high yield can protect from the deformation, so we need some material having high yield that can actually prevent the deformation, so that we can actually target the prostate tissues, actually the accurate targeting of the prostate tissue. So the nitinol tube and the wire is selected. It provides enough yield to and affords an angle of 45 degrees, that we discussed that we need a 45-degree angle for full coverage of prostate tissue. Okay, then we are coming toward the positioning sensing. Positioning sensing is detection of the path of the needle. There are three kind of position sensing: electro-optic encoder, passive fiducial tracking, active fiducial tracking. Passive fiducial tracking actually encodes the position of joints. Okay, so it basically it is encoding the position of joints and coordinates, but then it needs calibration because of deflection of the material. It is causing some uncertainties, so it is requiring continuous calibration, so there is a chance of error to happen. And here the prostate tissue itself is small, the needle is small, so we can't afford the uncertainties. Then the passive fiducial tracking, it is basically provide information about the end effector in MRI coordinates. So it provides us the information, the position information, but that is not sufficient enough. We need a lot of image processing to done on those coordinates to get exact position of the target. And then we have the active fiducial tracking, which is the most faster and accurate encoding method that we will be using in our manipulator. Then we have MR image guidance software, that is a graphical user interface for physician to view the position of the needle, the coil positions. It is actually a custom visualization and targeting program which displays MR imaging and read the tracking coils positions. There are some additional materials. For example, the plastic is used to build guide to prevent disturbances, but then the needle is of ninitol material. Magnetic materials of prohibited, strongly prohibited due to strong magnetic field. That's what I was explaining in the case of aluminium and the brass. The brass is used for smaller nuts and bolts, and the aluminium is minimally used. And the bronze is mostly used in the assembly, in construction of the assembly. Okay, coming toward the performance evaluation. In our case, we performed everything with GE Signal Excite 1.5T MR scanner. We used this device. The experiment the experiment was done on patients having the two goals. Goal is validation of the needle targeting accuracy of manipulator, that whether the needle is actually touching the target or no. And the second thing we done, 4 markers are placed on each patient, different places. Basically you can say the 4 needles are placed in the patient's left, right side of the prostate, lower and upper side of the base. The lower part of prostate is called apex, the upper part is called base. So we can have the 4 marks to detect the vicinity, to discuss how much the cancer has affected the area. So the 3 kind of experiments we were done, that whether in vitro tracking accuracy studies, whether our manipulator is perfect for this thing, for in vitro tracking, for in vivo canine accuracy and clinical accuracy studies. So about the in vitro tracking, it was the manipulator was precise. Okay, the position of coils were actually recorded. Desired millimeter accuracy was positioning, as I described in my abstract, that millimeter, we are interested in millimeter accuracy of the needle, and that we are getting here. And millimeter accuracy, so for in vitro tracking we achieved the required results. For in vivo canine accuracy studies, accurate needle placement, the needle was placed on the target, injection and the fusel marker placement, the slice thickness, restrict depth measurement, hence the tip was visible in all imagings. This means that we did the accurate imaging, accurate needle placement, and what we wanted to do, injection and the marker placement, we did. But because the thickness of the skin of the human body, the thickness of the slice of prostate is not allowing us to detect the exact depth, but we can guess the depth by the marker, the point of the marker that is actually done. We will be seeing that in the next image. The tip was visible in all the surgery, so it means that the needle reached to the required position. In vivo clinical accuracy studies, there is minimal average in place displacement error, and still there are further studies that are under continuation for this purpose. So in this case, we have this target, this is the rectal sheath, the center of the axis, this is the prostate tissue, and here is a small black dot it is visible. That is actually the placement of needle, and that is actually our purpose to perform the experiment. And this is actually a screenshot of computer visualization program. Okay, so the conclusion is that our manipulator achieved the precise results, precise needle placement, precise imaging image targeting, placement and biopsy. The in vivo canine experiment and the clinical study, we observed that millimeter errors were observed, and still in clinical studies there are further continuation. About the research perspective, the tissue deformation while insertion of the needle is one of the problem we faced, and that is the topic for the future research. So the future research can be, we can use the 3T systems which has higher signal to noise ratio that can improve the image quality, and then which can actually help us for more image guidance and the target selection and about localization of the tumor, and we can detect the prostate cancer. That's all for my presentation. These are the references as about the previous manipulators that were designed. So thanks everybody for your attentions. See you.